Many patients are very interested to learn about the GLP-1 medications like Ozempic, Monjaro, Zepbound. Are these GLP-1 medications just for weight loss, or do they have other effects on the body, like lowering inflammation?
GLP-1 analog is a known anti-inflammatory, has anti-inflammatory properties, especially in autoimmune patients, because they think it is because you lose weight, and weight is inflammatory. Fat has like a 600 cytokine release. So when you lose that fat because of the GLP-1 analog, you lose inflammation, and you feel better and worse better, and decrease inflammation and less flare-ups.
How do these GLP-1 medications impact the autoimmune disease activity?
Obviously, GLP-1 analog will decrease the inflammation, and then we have studies showing better stability of the disease, no flare-ups or less flare-ups. And I think it's great for those patients with autoimmune problem.
Should GLP-1 be considered when we discuss the whole approach of a patient with autoimmune disease that is not well controlled?
Yes, if the patient has a BMI more than 27 and one medical conditions, when GERD or asthma and autoimmune, I truly think patient will benefit for GLP-1 analog.
I have to share something with you that happens in my clinic in the last 3 years. I started to use GLP-1 medication in conjunction with the standard treatment, not to replace the treatment, just to make sure. And the results were astonishing. Even in patients that had just a little bit of weight or extra weight, or even in patients that had uncontrolled disease and they didn't want to change the medication, just a little bit of a GLP, what people are calling these days microdose, it did help the patients a lot. So, like you are saying, the medications, they do have much more effects than just losing weight. And it seems to me that this effect on the proteins that are producing inflammation, the things that we call the cytokines, it's really, really powerful. And in the last year, like you have seen for HRT, there is a lot of movement to understand where is this anti-inflammatory effect coming on these drugs. And there are studies done in patients with rheumatoid arthritis or psoriatic arthritis that they do show improvement in their disease activity scores, decrease in the inflammation level, not only the fact that these patients would lose weight.
That's amazing, right? We should use that more often. It's a great, it's FDA approved. We should not use compounded for GLP-1 analog.